friends, I am Dr. Pavan Kumar, consultant cardiac surgeon and head of the Department of Cardiovascular Surgery, Leelavati Hospital. I've been practicing heart surgery, especially heart valve surgery, since last 32 years in Mumbai, and have treated more than 10,000 cases by surgery and seen thousands of patients of heart valve disease. All these patients have certain questions in their mind and which are very pertinent and burning questions, and I wish to answer these questions through this YouTube media and social media, so that they are aware what are the answers of their. First question is that heart valve disease or heart valve diseases require heart surgery. Answer is yes and no. More of them, the heart valve disease, when it starts, either whether it is a rheumatic heart valve disease or it is a degenerative heart valve disease, they start gradually increase and then they involve the heart valve functioning. Valve gets narrowed or valve leaks. In initial stages, it can be managed medically, whether it is a stenosis or it's a leakage in the heart valve, like aortic stenosis or aortic regurgitation or mitral stenosis or mitral regurgitation. It can be managed medically. In certain cases, an early stage of disease, a balloon valve procedure, valvotomy procedure can also be applied to these patients. Next question is that, is heart valve surgery an open heart surgery? Very important question, and many patients usually ask. Answer is yes. All heart valve surgeries are open heart surgeries because the valve is situated between the chambers of the heart, and we have to open those chambers to access that valve, to whether to repair or replace the valve. So to reach the heart valve the heart chamber, we have to arrest the heart by putting patient on a heart-lung machine and then stopping the heart and opening that chamber. Whether it's aortic valve, which is we access through aorta, whether it is a mitral valve, we have to access through the upper chamber of the heart, left atrium, or it is a tricuspid valve, we approach through right atrium. So all these chambers are accessed only when heart is stopped, and then we access these valves and do surgery on them. Third question is that how do one decide that a damaged heart valve requires repair or replacement? Yes, most of the times patients have heart valve disease and they come and ask this question, whether this heart valve can be repaired or ultimately you have to go for replacement. Yes, in initial stages of stenosis, as I told you, narrowing of the valve, it can be repaired by surgically or intervention. Cardiologist can do opening of the valve. Or if there is a leakage, which is an early stage of leakage, it can be repaired by interventions, or we can do surgical repair also. But if narrowing of the valve has reached advanced stage, the valve has become calcified, and then and the leakage is almost grade 4 leakage, then probably it's a case of a heart valve replacement. Now, fourth question is that, is heart valve replacement surgery safe? Almost 90% patients will ask this question, and my answer with my experience of over the last 32 years, heart valve replacement surgery is very safe. Whether it is a single valve replacement, or it's a double valve replacement, or it's a triple valve procedure. In 90% cases, it is 100% success. But in late stages of the heart valve disease, when heart is in failure, with the body comorbidities of lungs and kidney and brain and age, there may be certain amount of risk involved in doing heart valve disease surgery, the replacement or repair surgery. Fifth question is that the heart valve surgery, what precautions should be taken after heart valve surgery? It's a very important question, and almost all patients, those who undergo heart valve replacement surgery, ask this question. My answer is that if your heart valve replacement surgery is done using tissue valve, which is bovine in nature, then you may require blood thinness tablets for 3 months. But if you have undergone a heart valve replacement with mechanical heart valve, then you may require or you will require blood thinness medication or anticoagulation for lifelong to make this valve working throughout your lifetime. And it is not very difficult regime or treatment, and it can be safely managed by doing your blood thinness testing all the time, repeatedly at fixed intervals, and keep your surgeon involved in the management of your blood thinness, and it can be done very safely. So these are the important points which should be kept in mind while when you decide about your heart valve surgery, what kind of care and what kind of post-operative management should be done after your heart valve replacement surgery is done. Thank you very much. Next time again we will take some more questions about heart valve surgery, and patients have in their mind the important points to discuss with your surgeon. Thank you very much.